Hello everyone, I am Sonia Musakuti and this is my first YouTube video. I would like to talk about something very basic and important for us. Many find it difficult to understand the basic differences between primary and secondary dentition. So in this video, I will be making this small topic easy for you. So before going into a topic, please don't forget to subscribe my channel, like this video and share this video to your friends. The differences between primary and secondary dentition can be broadly classified into 5 groups: general, pulpal, histological, morphological characteristics of both crown and root. There are basically 4 general differences for both these dentitions. One is based on its number, then based on its color, and the presence or absence of premolars or molars. Next is the pulpal differences. Unlike our permanent dentition, in deciduous dentition, the dentin is thicker, the pulp chamber is larger, the root canals are ribbon-like. An important point to be noted here is that most of the accessory canals in deciduous dentition are in furcation area. Next is the histological differences between deciduous and permanent dentition. For deciduous dentition, I have made up a mnemonic which is easy for anyone to memorize. So the mnemonic is ABCDEF3. A stands for apical foramen, which is enlarged. B stands for blood supply, which is abundant. C stands for cap-like zone of reticular and collagenous fibers. D stands for density of innervation, which is less. E stands for response to external stimuli, which is typical of inflammatory reaction. The 3 F's stands for formation of reparative dentin below the arrested caries, which is more extensive. Infection and inflammation, which is having poor localization. Nerve fibers which terminate in the odontoplastic region as nerve endings. Next is the morphological differences of the crown. In deciduous dentition, I have made up another mnemonic which is B4, E5, A3, scold. The 4 B's stands for bulbous crown, broad contact area, buccal and lingual surfaces of molars are flat, buccal and lingual surfaces of the first molar converge occlusally. The 5 E's stands for enamel dentin junction, which is more sinus, enamel is thin, enamel cap end in a marked ridge, enamel rods at cervix slope occlusally, enamel's mineral content is more organic. The 3 A's stands for all teeth have marked constriction at the neck, all teeth show neonatal line and absence of mamelons. The scold, the S stands for show more attrition, crowns are wider mesiodistally, occlusal table is narrow, less tooth structure covering the pulp, dentino-enamel junction is flat. In case of morphological differences in the permanent dentition, the crown is less bulbous, the crown shows less attrition, mamelons are present with thicker enamel and a more covering of enamel and dentin. There is no convergence of buccal and lingual surfaces. The crowns are wide and cerviculo-occlusally. The buccal and lingual surfaces are rounded and only first molars are having the neonatal line. So these are the basic differences that we see in the morphological differences in the permanent dentition. Next is the morphological differences in the case of root, which is seen in deciduous and permanent dentition. In deciduous dentition, the roots show an physiological resorption, where the permanent dentition, it doesn't show any physiological resorption. In deciduous dentition, the roots are slender, long, short, divergent and flaring. In the case of permanent dentition, it is short, robust, long trunk and it is less divergent and do not flare. That is the end of my today's video. I hope all of you found it useful and interesting. So as I told, don't forget to subscribe my channel, like and share.